Hi, Dr. Ramos here with Dr. Richard Gans from the American Institute of Balance, and we're so excited to have you with us here at the FCOM meeting. Tell me just a little bit about what's been going on at the American Institute of Balance.
Well, thank you, Dr. Ramos, and it's really great to be here at FCOM. It's just been a fabulous event. Well, over the last 2 years, we've taken our 30-year history of providing dizziness, vertigo, rehabilitation care, and we've extended it nationwide. So we now have 90 clinics throughout the United States, actually in 31 states, with audiology, neurology, otolaryngology. And what we do is we're helping these practices deliver gold standard quality of care to patients who have dizziness, vertigo, fall risk, either from otologic, non-otologic conditions, providing them with all the guidance they need to help the millions of patients nationwide who need this care.
So, Richard, tell me a little bit about these last 18 months have been really difficult for everyone, right? But especially in the healthcare industry. How do you think that that's impacted where we are today?
Yes, it's absolutely been a difficult time. Our clinic had to close, was mandated to close for 2 months during the earliest part of the COVID pandemic. Once we reopened, truly the floodgates were thrown wide open for us. Patients are very, very concerned about health. They became very hypervigilant about their own health. If all of a sudden somebody got a pimple, they thought it was COVID. Mm-hmm. So of course there was a huge demand to get in to see providers. But this was challenging because you had a backlog, your schedules could only control so much. And what we started to see was really the true emergence of telehealth and the patient's acceptance to be able to sit in front of a FaceTime, in front of a computer screen, and speak to a provider, whether it was an extender, the physician, and this was really a lifeline to them. And I think going forward, telehealth is not going to be just a quirky, ancillary one-off. I think you're going to see more and more physicians, extenders, and patients all embrace this great accessibility through telehealth.
Well, and telehealth is not new, all right? It's been around quite some time, but I do believe, and as we saw also, that the patients were more accepting, and I think some of the providers are more accepting now as well. And they know that the technology, you can reach your patient where they are, and that's important.
Absolutely. In the FaceTime, face-to-face is what makes the difference, opposed to just a call. Because they want to read the facial expressions.
Right.
They want to have that connectivity with their providers.
Well, and I think that speaks to how we live everyday life, right? Where we want that contact. And I think with your provider, it's really essential. And so having that visual to your provider and you actually being able to read your patient is important.
Absolutely.
So FCOM is a different kind of meeting, and it's a meeting that we've really focused on bringing all providers together that actually work within the patient and learning from the same playbook, so to speak, so that the continuity of care can really be continued throughout that patient journey. As an audiologist who works with physicians, we have a lot of interaction with a lot of medical professionals, but I feel like a lot of times we don't really all hear the same message, and that's really the mission of FCOM. How do you think that will impact patients moving forward?
Well, it can only help. Having all the players in the same tent at the same time, making sure everybody is speaking the same language, understanding that everybody's got their oars in the water and we're all rowing in the same direction. Medicine today is not your grandfather's healthcare. So it's all about providing cost-effective, patient-centered care. And this is critically important. As the cost of healthcare continues to rise, we all feel the pinch. The providers feel the pinch, the patients feel the pinch with higher deductibles, higher premiums. So our goal is to make the patient journey as seamless, as transparent, and produce outcomes so that they get to live their lives with a high quality. And we want those Google and Facebook reviews, don't we? And part of that is making sure that we leave our patients with a good feeling. So this has been fabulous. We'll be back next year.
So Richard, I just can't thank you enough for your participation in this meeting. I think that we hope to have you back next year, and that we will continue to build on the program, and absolutely think it's a vital move forward for us in medicine.
Well, congratulations to you and your team. This inaugural event has been fantastic.